She said that they were processing it this morning, getting it over to Treasury by hopefully this afternoon, and again, hopefully payments will go out next week.
Right on. It's 8:42.
But deadline to apply September 15th.
Let's go ahead and get Dr. Ann Pobutsky on, the Guam epidemiologist. I think we're going to do a screen share, quite possibly, Jay.
Okay.
Okay. Doc, are we going to do a screen share?
You want to?
Yep.
Yeah, why not? Wait, is your screen vaccinated?
Well, hang on.
Okay. I don't want to share screens unless your screen is vaccinated.
Okay.
Yep. You got screen share rights, Doc?
Okay, so Doc, I know you got a lot of data about, just about a lot of things dealing relative with the surge and just the pandemic as a whole. So I think we're just going to go ahead and give you the floor and let you present the data, and then we'll come in with a bunch of really hard questions afterwards.
Okay. I hope you can see this one. This we actually did last week. And what I'm going to show is a switching of screens from the last 8 months to the surge. And as you can see, this is our surge here. This is our August surge. And that's from January till this is the end of August. Nothing has changed in September. We are just now adding those numbers in. It's still going up. And this is what the surge looks like through the end of August, just July and August. This is an interesting slide because it gives a whole year. These are hospitalized cases. The previous two slides were just cases. This is hospitalized cases and numbers in the ICU. And this is for the full year. So if you see in January, we didn't have as many cases, but we had a lot of people in the ICU. That was the carryover from what was happening last fall, when we had a surge in the fall and it kind of continued all the way through, here we go, January, February. Then we see, we kind of have a dip there in the ICU, nothing happening, which is great. This, again, is the hospital, island-wide. And then here's the surge in August. These are the hospitalized cases, and these are the ICU numbers, and you can barely see some of the deaths here in red. But what's interesting is, despite the surge in cases, we're not seeing, even though we see high numbers in the ICU, it's not corresponding to the high ICU rate. We're just seeing it's similar to what it was back in January, suggesting there's a protective effect for the vaccine.
Right, Doc, I just wanted to go in on this just really quick. So, because a lot of people have questions about, obviously, I'm sure you're well aware, people have questions about the vaccines, and we're dealing with this. We're coming up on the booster shot. So we know that the doctors say that the effectiveness wanes 6 to 9 months after taking it. But like I always say, when people say, oh, the vaccine doesn't work, I mean, are you just basically saying that if the vaccines didn't work with all these positive cases, we would have 300 people in the ICU or something crazy like that, right? Is that basically what you're saying?
Right. And more deaths, even though we are seeing deaths, and I'll get to the deaths later. Yeah, it is working. There is a kind of a protective effect. The problem is, yes, we have seen breakthroughs, and I'll show you this in a second here. But it's not like it's making the hospital like it can't function. Although the hospital, there's too many people up there. They can't hardly handle it. Yeah. It wasn't built for this. This is the same slide with our surge. And again, ICU and then deaths. It's just the last 2 months. I'm going to skip the next two slides. This is a comparison of what we've seen for the year comparing DOD and civilian cases. And this is where we noticed back in April and May, we started seeing this increase in the military cases. And we met with them. It was right after we kind of were concerned about these military cases that they did a mask mandate on the base.
Right.
And then it takes off in the civilian population. You can see it just jumps.
So what does that mean, Doc? Is there a correlation between the military cases and the increase in the civilian cases?
Nothing we can prove, but it's very likely that somebody brought it in. I don't know if they were military, but we did have, over the summer, 4,000 people doing training here. I don't know if you saw the ships and the helicopters and all that. It could be that someone brought it in and it just surge. We don't know. It could have been another type of traveler as well.
Right.
We have no proof of anything.
Right.
Sorry.
Yeah.
We can't test every, person and find out where it came from.
Right. Yeah. It's just that I've seen that. I've seen
and
that
this is
chatter.
the same thing. You can see.
But,
You can just see a little more clearly the last 2 months.
oh, man.
Yep. This is where we really started seeing this jump, and we were watching it, and then boom, the civilian population cases take off. This is by age. As you can tell, this shows everybody's affected by the surge. And then this is July, August, what we're seeing, and this has continued. This has not changed. This major group, the 18 to 39 group is the big one, followed by the 40 to 59, 40 to 59, and then the kids.
What are we looking at
And
here,
we're
Doc? So this chart is.
Well, the other thing is, look at the elderly. Even though it's gone up, it's not high as they're not spreading it. I mean, they're affected, but this also suggests a protective effect because elderly are the ones who are mostly vaccinated.
Right. So can we just go back to that?
That's just the test.
Doc, I wanted
Sure.
you to, if you could just tell us exactly what we're looking at with this graph here. The gray line represents exactly what?
18 to 39, the number of cases in the past 2 months. Again, going back, you see there we had very little going on with all the age groups, and then boom, it starts to take off early August. And here's what it looks like for the last 2 months. Those are cases in that age group. This is the driving force. And then again, some of these other groups, elderly, much lower. And of course, we see it taking off with the kids. And
Yeah.
I have some other slides in another. This is our testing and positivity rate. It just follows the surge. Nothing there. Oh, here's your breakthrough cases. Everybody wants to know about the breakthrough. Well, during the surge, it's really taken off. The breakthrough cases are in blue, and then here's the last 2 months. It almost mirrors each other.
Yeah.
We are seeing breakthrough cases, but the vast majority are unvaccinated people. I'm going to switch now to a different set of slides we compiled this week. We also looked at the number of people who were vaccinated by age. And as you can see, these are ineligible kids. So all of these cases, I think it's 499, 500 kids who have had, this is again, the full year. They're in blue, they're not vaccinated. But look at this group, it's the same group that's fueling this surge as the largest number of cases are unvaccinated. And yes, we do see the 40 to 59 group, less so among the elderly. And yes, we are seeing some breakthrough cases, but it's nothing compared to the younger people who are unvaccinated.
So,
that's what's driving this.
Doc, can you
and if you'd like to see by ethnicity, who are these people?
Oh, man.
They're Chamorros.
Ay, familia.
Yep. And then, again, this is the full year. We're still seeing the same thing, even if you look at the last several weeks or the past 2 months. It's the same pattern. We're seeing the same pattern. It's the Chamorros, it's young people. And of course, we see Filipinos, Howleys, Chukis, a lot of unvaccinated people. Filipinos have high vaccination rates. It's just meaning they're exposed because they're, exposed to people.
So, Doc,
and then this is the same thing with ages. This is the same. If you want, I'll go through it, but I don't need to.
So
this is
you're basically
a recap on the
saying
ages.
the super spreaders during this surge are, let me just get this straight, unvaccinated 18 to 39-year-old Chamorros?
Yes. And there's some Filipinos, but the Chamorros are the biggest group. And if you look at the vaccination, they've been lagging. I just was looking at the vax numbers, and the Chamorros are right now at about 50% fully vaccinated. Now remember, this is just for civilians. The JIC always reports the military cases as well. We don't get those numbers. I think they're getting the totals, but we don't have it by ethnicity. But the Chamorros are still lagging behind. This is as of the 9th of September. And of course,
Doc,
the
did you turn
Chukis.
your screen share off, Doc?
I did.
Oh, okay.
Yeah.
No worries.
Yeah.
I just lost it. I want to make sure.
Yeah, I did. Just so I can see this other.
Right.
Yeah.
Doc, we had a
So-
comment here. If you could, before you go on, can you please define breakthrough cases?
Yes. Hang on. I have to go look for that too. It's here. Breakthrough cases. It's defined as someone who is fully vaccinated 2 weeks before they got a lab report that told them they were infected with COVID. So a fully vaccinated person could be anytime, at least 2 weeks or more before they got a positive lab report.
Right. Before we get into the because we did want to talk about the kid cases, but just so if you could explain to people, right? Because when we look at the numbers of hospitalizations, and I know your data is definitely a better example because it's, well, longer, and this is kind of a snapshot. 44 unvaxxed, 29 vaxxed, right? So, and we've seen this kind of fluctuate where the hospitalizations, at least, there hasn't been, at least in the last few weeks, a really huge difference between the unvaccinated and the vaccinated hospitalization numbers. Can you kind of go in and explain that to people? Because some people look at it and, like, I don't know if it's, we haven't had the data about the vaccinated patients in the hospital. When did they take the vaccine? What type of vaccine did they take? How severe their illness is? So what would you say to those people who look at this and they say, like, oh, well, why should I take it? People are going in the hospital.
Okay. Number one, I have not looked in detail at that data. I just started getting the hospital data on my phone a couple days ago, and I'm going to look at it. We're asking the hospital to provide us with the spreadsheets with the numbers for the past couple months. It's going to take us a little while to really get into it. The daily numbers can fluctuate. Okay, and we haven't really taken a look, but yeah, so what? There's vaccinated people at the hospital. There's also vaccinated people who got sick, but we are not seeing like a crisis mode. Like they're in Idaho, they're rationing healthcare. We're not there yet.
Yeah.
The biggest pattern that we're seeing right now is actually people. We didn't see this before. Prior to May 4th, there was only 2 people who were dead on arrival with COVID to a hospital. Now we've got 11 cases, and possibly we have 3 more John Does showing up at the hospital dead, mostly cardiac arrest, or they don't know what caused it. And that's a brand new pattern that we're seeing with this surge. And these are almost all unvaccinated. There's only been 2 people who died ever of COVID on Guam who've been vaccinated. They were both extremely sick individuals with multiple severe comorbidities. Everybody else who has died this year has been unvaccinated. And now we have, in the past 2 weeks, actually it goes back to, it starts in May, but we're really seeing it in August and September. I haven't seen this before. Dead on arrival, cardiac arrest. It's just repeating. It's like 60% of the deaths in the past month and a half are dead on arrival, cardiac arrest, positive for COVID. They're not even getting a chance to be sick and get into the hospital. So that's a new pattern, and it's likely because of, and again, a lot of them are elderly. These people should be vaccinated. If you're elderly, you should have a vaccination. Protect yourself. It's possible you could die. So that's what we've been seeing. And we're tracking, again, 3 more John Does. There's been 1, 2, 3, 4 John Does in the past couple days. COVID positive. They could also be dead on arrivals. We don't know. That's what we're seeing. That's a better indication of what's extreme going on.
Right. Can
Not
you?
if you're vaccinated and you're sick and you went to the hospital because you're scared.
I got you. Doc, before we get again into the child numbers, can you kind of address the variant, Delta variant, what is the other one? The Alpha variant, the Mu and the UK variants, and which ones we have on Guam, and just how different it is, right? Because people, they say, oh, if you look at last year and you look at this year, we're doing just as bad as last year, and we have the vaccinations. But we've also heard from a bunch of the doctors who come on here that a big part of that is because of these variants.
Because of what?
The variants.
Well, we think what we're seeing is Delta, but we have no way of proving that, except for we know we have evidence for Delta arriving on Guam sometime in April, May. And we don't sequence all the samples. We give a sample to the CDC. It's not every test or positive is sequenced. So we think it's probably Delta because of the way it's behaving and because of the high household transmission and all that. But we have no way of knowing until we start sequencing ourselves, and hopefully we're going to start doing that before the end of the year.
All right, let's get into the kid cases, Doc, because I know you had some graphs prepared for that. Can we do the screen share again?
Sure.
Thank you. Guys, if you're joining us, KUAM TV, good morning. We're on right now with the territorial epidemiologist out of public health, Dr. Ann Pobutsky, and she's kind of breaking down a lot of the data that she's compiled, not just for this surge, which we're in week 6 of, I believe. I'm losing track, but data relative to the entire pandemic. And one of the big pieces of data that she had, really just told us about here is if you look at who's driving the spread during this surge, it's 18 to 39-year-old unvaccinated Chamorros. We got to have a talk, my Chamorro people. Now let's get into these kid cases. Doc, these graphs, I mean, we were trying to figure them out yesterday, so I don't know if you want to try and over-explain
No.
them.
These are real quick. It's just a summary. Because, again, the director asked for this and our chief public health officer saying, okay, what's going on with the kids? Well, to start with, let's look at, this is all, figure 3 here is all of 2020, and it's by age. And as you can see, you'll see the kids next. They're in there. People are acting like, oh, the children never got infected before. Yes, they did. They were surging along with everybody else. But we were seeing much higher case numbers in adults. That's all of last year. And this is the kids last year. It just doesn't surge as much as the adults. Right. Then if you look at 2021, nothing's really going on until we see this surge. And again, it's that the colors are different, but there's that 18 to 39 group. That's the big group. And then this is what the kids look like. So the kids follow everybody else, because if it's surging in households, and these young adults, 18 to 39 and or other groups, of course the kids are going to get it. Depends on what people are doing, how they're behaving. Are they having gatherings? Are they, you're in a household, you're going to see it spread. And then, again, this is all ages.
Can we go
July,
back,
August.
Doc, up to your graph for just isolating just the 0 to 9 and 11 to 17?
This one?
Right here, this one. Can you go into a little more detail? On the left side, we have the axis, and that represents the number of cases, correct? So if you could just explain what you're showing us here with the COVID spread among children 0 to 17 years old during the surge.
Yes, these are numbers. And if you see, I've used the same axis on the side so we can compare, so it's not different. Even though the top one, the first two are 180, these are 120. So basically, you're seeing the kids are surging along with the adults. What's different from last year is that the kids have surged past some of the adult groups, the 0 to 11, because they're ineligible for vaccination. It's a little lower with the teenagers. That could be because some of them are vaccinated. Or maybe teenagers aren't as good spreaders. I don't know.
Here's a question we had, Doc, from Roman. Without a firm tracing system in place, how did you determine that it was unvaccinated Chamorros driving the surge?
We did we have a master database of all the cases, and we have their ethnicity and we have their age, and we group the age groups into these categories that are related to vaccination rates. Like we have 0 to 11. We want to look at that because they are ineligible for vaccination. We look at people over 75 because they're at greatest risk. And we have ethnicity. So we cross-tabulate the numbers in a computer program.
Doc.
And that's how we get those numbers. I'm not making this stuff up.
I know.
Believe me, I don't want to.
I know.
I wouldn't imagine.
Can we just go back again to the kids and give it to us in the numbers? So for August, like how many total cases are we seeing? 0 to 11. I mean, we'll just keep it with the surge, right? So 0 to 11, how many cases? 12 to 17, how many cases during this current surge?
I can't give you exact numbers. I'd have to go to the data sheet to get the exact numbers. Okay. It's the trend that's important.
Right, I see. So what do you got to say to parents out there?
I'm sorry?
What do you got to say to parents out there, especially the parents of kids who are ineligible to receive the vaccines?
Well, there's not much we can do about that, whether it's, nationally or locally. What we can do is ask the people, adults, young adults, to get vaccinated. I don't know why there's still a lag and what people are reading and thinking about. This still is a pandemic. Keep saying this. It's not an epidemic. It's not a little outbreak of dengue where we have 20 cases. This is, what do we have? More than 10,000 cases. Okay, and Guam only. And, they're reporting on the national public radio that Guam is in as bad a shape as Tennessee and Louisiana and some of these places where you'd almost expect it. But it's like, Guam, come on, I thought the community was a little smarter than that.
Yeah.
People need to get vaccinated. We probably need to be at 99.9% vaccinated. The vaccines are working. I don't care what the media, the PDN and the Post and everybody's saying. They're not the source. They're the source of excitement and drama in the community. If you get cancer, a diagnosis, do you go to icancureyourcancer.blog.something? No. If you really want good information on your cancer, you go to the National Cancer Institute, right? If you've got some kind of weird, you don't go to some, I can cure your whatever, Morgellon fiber chip that's put in your brain by the military because it's giving you COVID. Come on, there's nonsense out there. They're not credible sources. We are the credible sources because we're counting the sick and the dead. And I'm sick of it. I thought it was over. And I know everybody else is sick of it. They want to have a party, et cetera, et cetera. I want a vacation too, but I can't take one.
Yeah, please don't take a vacation. Please.
So we want people to continue. There's no cure for this. There's vaccines and prevention. And if you're lucky, there might be treatment up at the hospital if you're really bad off. Yeah, it might not save you, though, particularly if you're unvaccinated and you're elderly and you have chronic conditions.
Right.
There's no guarantee. There's no cure. It's prevention and vaccines. So we need to get 99.9% of the population vaccinated because there's probably 0.01 or 0.1% that can't get a vaccine. We got to protect those. No, there's actually probably more. So we still need to get vaccinated and stop spreading it and stop infecting other people.
You make it sound so easy.
That's the bottom line.
Yeah. Doc, let me just ask you.
No, it is easy.
I know.
Wear a mask. Don't have a party with 100 people, etc.
Let me just ask, and I don't want you to get in trouble, so I'm going to try and ask it in a way where it doesn't step on anyone's toes, right? But just from as an epidemiologist, right? What we're seeing is 6 weeks of just uncontrolled spread. I mean, you know what we're looking at here. So, ideally, what would it take? Do we need any other types of restrictions? Because everyone says, oh, if you look back, what worked the first time was lockdown, a restricting of movement for everyone, right? And I know that we're moving forward with this aggressive vaccination effort, which I totally get. I get it, right? But it kind of seems like we're not really putting in measures that are stringent enough because it just doesn't seem like it's working, frankly. So what do we need to do? I know we don't have a party with 100 people, but is there anything else that we could do to really just throw a blanket on this fire?
Well, I know some of the restaurants don't even want to do that list of the vaccinated going in. They're just takeout only. I'm not eating in a restaurant. I don't trust it. Takeout only. The kids are not in school. Party in the open air if you got to do something. Go take a walk on the beach. I don't know. I don't think anybody wants to go to a lockdown again.
But would it work though?
It would. 2 weeks with a lockdown, except for police, fire, public health. But then people will get mad and, you know.
But it would work.
Well, probably it would contain the spread, you know. But nobody wants that. So it's up to us to do the other thing, which is vaccinate everybody, test who we can, and make sure people follow the rules if you're sick. And there are rules. Public health is telling people what to do. The clinics know what to tell people. If you're sick with COVID, don't infect other people. I'm not sure exactly what the clinics are telling people because we haven't been able to keep up with the contact tracing. It's basically just via phone. It's not like we can track everybody now. It's gotten out of hand because it's so prevalent. So much household spread, household transmission. It's everywhere.
Would you say
we want people to be safe? The elderly everybody should be vaccinated. This is ridiculous. That's all I have to say.
Thank you.
I think that's all you need. I think that's all you need to say.
Somebody commented, she's ranting. Yeah, of course she is. You'd be ranting too if you were in her position. Well, Dr. Ann. Yeah, here's a good one. Lisa and Joe Cruz comment, I'd rather have mad people than deaths.
You'd rather have what?
I'd rather have mad people than deaths.
I would too, because these are preventable deaths. They are preventable deaths. And it's really unfortunate. Elderly and middle-aged people. We're seeing middle-aged people who are also dead on arrival, cardiac arrest. It's either something about how nasty the virus is or people have underlying conditions. It's like, wow, you don't even get a chance to go into the hospital. You're just dead on arrival.
I'm going to have a good talk with my fellow 18 to 39-year-olds this weekend, and we're going to sort this out. Doc, thank you for your time.
Okay.
Take care.
Take care, Doc.
Adios. Thank you.
Right on. Thank you.
Have a good one. That, ladies and gentlemen, is what you call a mic drop.
Yeah.
Or a bombshell. Or just basically knowledge being passed on.
Man, my Chamorros. Come on, guys. I mean, you know what to me is...
So again,
she just said that they are like lost with the contact tracing.
So to basically recap, she said the number one demographic is Chamorros age 18 to 39.
Yeah, the guys, this is not something we want to be number one in. Because I know we're like, yeah, Chamorros are number one, but we don't want to be number one in this.
Let's get to news.
Let's get to news. Yeah, we're going to get to Major Anton Uggan shortly, but we're going to get to news right now. It's 9:10 on a Friday morning, September 10th, 2021, brought to you by Pacific Points with the very latest from the KUAM News team. Sabrina Salas-Manzanotti, good morning.
Off it, everybody. The island marked its 155th